Welcome back and thank you for staying with us. The coronavirus pandemic has exposed the various cracks in the healthcare system.
And at a time when the Ministry of Health is grappling with many cases, now strategies like home care are now the go-to option.
However, self-isolation means economic hardship.
And the high cost of treatment leaves many reluctant to get tested.
This is all contributing to the spread of the virus and has intensified the debate around the subsidized healthcare.
And Walter Mwesije has the details. Let's take a look.
Dr. Fiona Atuhewe, an employee of the World Health Organization, contracted COVID-19 at her workplace in Congo-Brazzaville, where she is in charge of new vaccine introductions due out in April. Dr. Atuhewe says she is lucky to be alive and also to be able to afford the best health care because after 4 months of nursing the disease, she is now dealing with post-recovery treatment.
People just hear she has been taken to Mulago. She's out of Mulago. Full stop. They do not know what follows after Mulago. Because the hardest part is what follows after Mulago or after hospital. It is very, very difficult. I had issues with controlling my blood pressure. So meaning when I stood up, for example, I would automatically fall back down. So I have to take time when I get up from bed, first sit up and then stand up. I cannot just get up like I used to get up at the time. But by the time I came out, really, I was much better. I was just happy to be back to normal life.
And there is also the fact of dealing with severe depression.
And the depression was determined by so many factors. It's determined by people out there who do not know what people are going through.
She believes her post-care treatment surpasses 20 million shillings.
But you must have money enough. And I'm telling people, if you have a family of more than 3 people, have 100 million on your account.
But what is the actual cost of treatment? According to Dr. Charles Olaro, the Director of Health Services in charge of curative services, there are several cost drivers for COVID-19 treatment on all fronts for patients, healthcare workers, and health facilities. These include personal protective equipment, medicines, non-medical supplies like dustbins, garbage, polythene bags, oxygen and its delivery equipment, additional health workers, and feeding, among others.
Every time the person goes, you will put on $25 of a coverall, and then you will put 25,000 for a KN what? 95.
Diagnosing COVID-19 starts with tests. In a government facility, you will have to part with about $50, approximately 183,000 shillings. And without at least $100, which is roughly 350,000 shillings, you cannot do a swab for your COVID-19 test in a private facility. Some people think the government charge should be further subsidized.
Especially during this time when people have lost their jobs, others are unemployed, as you can see the groups on the streets.
Even me myself, I cannot afford to lose 180,000 just to go for a COVID test. Yet we have other problems at home.
At least if government could subsidize to around 40,000 or 25,000.
They can do like they have done for HIV, where these tests are given at free cost.
Even if government decided to waive off the testing fees, the current infection trend shows that at one time our public health facilities may stop admitting patients suffering from COVID-19. Now this means if you're accessing treatment for the same infection, you may have to meet some, if not all, the important costs for your treatment. And these are not limited to X-ray scans or consultation fees, which may go up or over 500,000 shillings. But this is just the beginning of the expense. Once you test positive, Dr. Olaro now breaks down the cost of managing a hospitalized patient in both private and government facilities.
On average, you spend 10 to 15 days. So for your full stay, you'll need about 7 million shillings. For those are really the patients who are mild to moderate. But if you look at now those who need high dependence services, on average per day is 1 million Uganda shillings. And the average stay is about 15 days. So 14 to 15 days, which means that you need about 14 million shillings for that. Now, if you look at those who are critical, who are admitted in the intensive care unit, it needs 2.5 million shillings per day. About 10 to 15 days, you take about 30 to 75 million shillings to take care of what? One patient. If you go to the private, definitely the cost is much more what? Like a ward admission, which government is charging, which would cost government about 500,000, it will cost you about 1.5 million shillings. And then high dependence, you'll have to pay 2.5 million what? Shillings, and an intensive care bed is between 3 million and 8 million what? Shillings.
What about those with insurance covers?
The different medical policies have limits. When you buy a policy, there are limits on the inpatient, there are limits on the outpatient. So you may find that if you're diagnosed with COVID, the treatment alone may exhaust your budget under that particular cover.
There is no specific time for recovery because the infection can cause multiple damage to several body organs, but most importantly, it impacts one's mental health.
And then we have people who are symptomatic, and those ones come out and think they can advise people who have been in ICU in Mulago. You think you can advise somebody who has been on oxygen, say, no, you'll be fine. It's not true, because it takes time.
Uganda has, for the last several days, recorded triple-digit numbers of infections per day, and experts warn of a sharp hike with the current political period and as we head into the festivities.